Proper handling of heart conditions to avoid fatalities is essential in our day-to-day lives. To this end, a training organized by a Prudent Heart Care Foundation for medical personnel has been held in Lagos to educate Nigerians, not just health workers, on the need to know how to handle heart conditions when they suddenly occur. Health correspondent Jacqueline Ogo reports.
The training for medical personnel on health care was expository. The key interest of the trainer was to see that the trainees become well informed on handling heart conditions, especially in emergency situations as well as symptoms of a stroke.
So if the heart stops beating at any point in time, mindless of the patient's condition or the victim's condition, it can actually lead to a cardiac arrest. Now, these things are, what are those conditions? Hypertension that has been long-standing, a diabetic, somebody having chest discomforts that was ignored, some road traffic accidents from our bad roads.
Prudent Heart Care Foundation wants the government to install heart resuscitators in the malls in cities and towns across the country, as well as other strategic locations, to ensure people are easily rescued from death in emergency situations.
I would encourage that everybody gets trained in the use of these equipments, healthcare professionals. Then, for you and I, we should know how to do CPR. I encourage that a whole lot.
There was also a word for Nigerians who get out their cell phones at accident scenes.
If there's an accident, you see that people bring out their phones and take selfies with the victims and all that. No, but we're encouraging people to make use of their hands whenever they notice that somebody has slumped over and not responding. You just tap, hello, are you okay, sir? And the person is not responsive. It's just good to push at the center of the chest and help save that victim's life.
Among information received by the trainees were how to understand irregular heart rhythms, when to give or not give fluid in emergency heart conditions, what to do when a patient is pulseless.
I've learned tremendously well when it comes to ECG readings and interventions. When you detect abnormal electrical rhythms, things you need to do, especially in the case of emergencies. I've really learned pretty lot.
It's not just a medical personnel that must handle a patient with heart problems. When you find somebody lying down and then not responding, you can actually do the help by using your hands to give compressions.
In all, the government was advised to ensure that medical equipment are not just purchased and dumped in the nation's hospitals. Health workers should be trained to use them effectively for the desired results to be attained. Jacqueline Ogo, TVC News, Lagos.